name is Faith, and I work for Population Services Zimbabwe. We are an affiliate of Maristops International, and as an organization, one of the strategies that we have is to ensure that we reach out to adolescents and young people within our country as an aim to try and also reduce teenage pregnancies within our country, which is currently at 22%. And we want to leave no one behind as an organization. So we want to ensure that in the services that we provide, we ensure that we include young people. So we are one of the major service providers of SRH services in the country, especially family planning. So we have quite a number of channels that we have as an organization. We have the outreach channel. This channel is a free channel which moves around in the country, providing services in all the districts, like a mobile clinic. And then we also have static clinics as well, where we provide services within certain districts. We have clinics there. And we also have what we call public sector strengthening as well, whereby we partner with government institutions, clinics within the government. Most of them, they are in rural areas that we partner with. We do provide services by strengthening their capacities and also giving them resources to use as well. So I am the youth officer for the organization, and my goal is to ensure that I ensure that young people come and access services in any of our clinics, or be it in outreaches and all. So one of the strategies that we have started to employ is to introduce what we call traditional games here in our country, so that we lure young people to come to our centers. So like I had said, we are one of the major providers of family planning services in Zimbabwe. So you see by the name of it, family planning, most young people wouldn't want to come to our organization because they would think that we only serve those that are married. And there's a lot of myths and misconceptions that is surrounded, especially when it comes to FP services. Young people think that they can't access FP services because if they get probably, let's say, Jadel, they might not then get pregnant if they would want to get pregnant when they are ready to be mothers. But we know that some of those are just myths, and so to address that, we introduced the traditional games in our clinics that we have. We have about 7 clinics within the country. So what we did was we went to a clinic, one of the clinics that we had in Gokwe, which is quite a big clinic. It is a big yard. So we did put soccer poles and all, volleyball poles and all, and everything. And then what we had to do to make sure that young people would come was to introduce the games that we play in our country, that has just specifically played within our country. These are traditional games that our parents grew up playing, and young people do play these games when they are in their communities as well. There's one that is called Nodo. Unfortunately, it's a game that I couldn't, maybe there's need of a video for us to then show you about the games that we play, but we didn't have the videos for those games anyway. So there is what we call Pada. So we brought young people together and created a tournament in that area so that young people would then come. So that way, when we introduce these games, parents would then allow their kids to then come and visit our clinics, because they would know that they are just going there to play games. So when they come within our clinic, we then start giving them SRH education. So during the tournaments, we set up information booths around the area. We also invited the organizations as well to come and share what their information on SRH, or even provide services on SRH as well. So during the day, we had a number of SRH services that we provided. We had HIV testing, counseling, we had circumcision, we had contraception services as well. We had menstrual health, hygiene as well, whereby we would distribute reusable pads to those that are underprivileged as well. So this was an opportunity for us to interact with young people and actually demystify those myths that our organization doesn't really work with young people. So now young people feel they are now comfortable to get into our clinics, because sometimes they can just say after work, they can then come, and if they want to play soccer, they can come and utilize the grounds. If they want to play the pada or one of the traditional games, that they can come and also utilize the grounds as well. We also bought the soccer balls, the netball balls, the volleyball balls as well, so that we can allow them to then come whenever they want, they come. So we also are in contact with the schools that are around the clinics. And we also tell them that if you don't have space to practice, if you don't have space to do any tournaments, you can also utilize these grounds. So by doing that, this allows us to get access to young people and give them information on INSARA aid services as well. So this has been quite a helpful strategy that we have implemented. And we do hope that we will be able to get probably more funding so that we spread it across all the clinics that we have, and also to the public sector clinics that we also work with as an organization. We are actually planning to do that, and we are putting it in proposals that we are writing, so that we ensure that we reach out to more young people in our country.